Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. Yesterday, a 76-year-old man from Karnataka became India's first casualty due to the coronavirus. This is reportedly India's first fatality due to COVID-19, the disease caused by the virus. The novel coronavirus has now infected more than 120,000 people across more than 100 countries and has killed more than 4,300. On Wednesday, taking the circumstances into account, the World Health Organization declared the virus outbreak as a pandemic.
In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
So far in India, at least 74 people have tested positive. This includes 17 foreigners, 16 Italian tourists, and a Canadian. In this episode, we will be looking at what India is doing to tackle the coronavirus. Joining us first is Abantika Ghosh, who reports on health for the Indian Express. Abantika, I first wanted to ask you, what does it take for a disease to be termed as a pandemic?
So the difference between an epidemic and a pandemic essentially is the spread. An epidemic is localized, and a pandemic, by its very definition, is something that has spread across countries, that has affected the entire globe. And we don't know where it will travel next, which is exactly how corona is right now. So we don't know which country the next corona case will come from. Is it from one of these 100-odd cases where the disease has spread, or is it going to be a new country? We don't know. That, in essence, is a pandemic, and that is why WHO has declared this as a pandemic.
So it has nothing to do with severity, but more to do with how it's spreading, right?
Absolutely. It has to do with the geographical spread of the disease, how many countries, how many people. It's just a means of getting countries on their toes and telling them that, hey, even if you're not one of the 100 countries where it has spread, tomorrow it can be you. Just be very careful, be prepared, take all the precautions, do screenings, get travel advisories issued, do whatever it takes to prepare yourself and your citizens for a possible incursion. And it also warns countries which already have it to control the spread, to not let people who are infected travel, all those things. It's to get a certain level of preparedness among countries.
What are the kind of measures that India has taken since it was declared a pandemic?
Right at the same time as the World Health Organization was declaring that this is a pandemic, India has decided to suspend all existing visas till the 15th of April. And this comes into effect from 12 midnight on March 13th. This does not apply for people who are already in India, and an exception has been made for all those who are on diplomatic or official visas or working for UN or international organizations, who are on project visas or who are on employment visas. They are exempt from this. But everybody else, and this includes OCIs who normally do not require a visa to travel to India, even they cannot travel till the 15th of April. So all visas stand cancelled. And any Indian who is abroad can come back. But if the government feels the need, the person can be put on a 14-day quarantine. For some countries, that is mandatory. These include China, Japan, Germany, Italy, Iran, all the worst affected countries. If you're Indian there, you can come back, but you will be on a 14-day quarantine.
Okay, when we talk about putting a country under lockdown, like we've seen Italy do that, imposing strict travel restrictions, banning public gatherings, cancelling events. Could you talk about exactly how that helps? And also if we've seen that help in other countries, say China?
We have seen cases come down in China, whether that is because of the lockdown or because of the natural cycle of the virus or changing weather conditions and all of that, we don't really know. But as far as India is concerned, we have not actually banned public gatherings, but we have issued many advisories. We have had the Prime Minister talking about avoiding holy millons, and there has been so much noise about this. I suppose people have started avoiding gatherings on their own. And these sorts of things, obviously, the lockdown will prevent incursion of the disease from abroad, which is how the disease has come to India in the first place. And most of the spread that has so far happened is traced to somebody or the other who's come back from abroad, except there have been a few instances of community transmission, as the Ministry of Health gave out last week. But otherwise, mostly you can trace it back to a person who's traveled from abroad. So that is why the lockdown had to be put in place. This also means that fresh cases are not there. And if you're quarantining all others who are coming back from these countries, or even if you have kept that option open of quarantining anybody, because that effectively means that tomorrow, if a country where there is no case reported develops a case and an Indian comes back, you can just put, and because also we have also invoked the Epidemic Diseases Act 1897, which is a very stringent act. It goes back to 1897, and it just gives the state a lot of authority. The state can check you suddenly. It can just enter a train and check and ask your travel details, and then it can put you on home quarantine. All those things, the state now has the power. Obviously, it will have to be notified by states because health is a state subject. So yeah, we've done a lot of things apart from the lockdown, and let us see how it pans out.
The other thing is, like, right now we are recording this on Thursday afternoon, and so far there are 73 positive cases in India, including 3 who have already recovered, the early ones that we saw in Kerala. If we see the numbers go up, what kind of burden do we see this putting on our public healthcare system?
This is a very big test for the public healthcare system. But I must also mention that there is a separate, all this contact tracing and everything that is being done by a separate program, which is called the Integrated Disease Surveillance Program, which was set up in 2004 exactly for the purpose of this, tracking outbreaks. On a regular basis, they track 33 diseases. This is a new disease. But otherwise also they track 33 diseases. They are equipped for this kind of role. But obviously it is putting a lot of pressure on the public health system, because for fear of uncontrolled spread of the disease, if you develop any cough and cold symptoms and you have a travel history to any of these places which have been gripped by the disease, then you have to travel to a government hospital. You will be tested in a government laboratory. There are collection centers. So in a bid to contain, many private clinics may have the wherewithal, but for the government, the main concern is to streamline everything, so that when you go to this designated hospital, all the staff there is dealing with only these patients. So you're minimizing contact. You're minimizing the number of medical staff who are among the most at risk. You're minimizing the number of medical staff who are in contact with you. So these things have been done. That being the case, there is pressure on the public health system. And so far we have coped, even though I am told there are some reports that some hospitals are keeping patients waiting for long for tests.
In what ways are we seeing people's daily lives being affected by this?
In actually unforeseen ways. One obvious thing is we are now hearing that hand sanitizers are out of stock. Also, I was just told this morning that theaters are empty. People are avoiding going to the movies, the metro, because even the health minister told us that public transport is a concern. So people are obviously trying to avoid, not that everybody can do it. This morning, a colleague mentioned that in Uber, she asked her driver several questions about whether he had just brought a passenger back from the airport. And then when she apologized, the driver said, "No, ma'am, no problem. Everybody is asking me the same questions for the last 5 days." So we are learning to live in the times of COVID. But I would say that while people are making a lot of changes in their daily lives and they are making a lot of adjustments, I would still say that if you observe the basic precautions of hand hygiene and not touching your face with unclean hands, not shaking hands with random people and touching yourself, all those things, then I think you're still safe.
Shortly after this recording took place, the Delhi government announced that all cinema halls, schools, and colleges will remain shut in the national capital till the 31st of March. PM Narendra Modi also assured that his government is fully vigilant about the prevailing situation and that multiple steps have been taken to ensure the safety of the citizens. Though one of the reasons that people have been worried is that this virus is new. We are still learning the ways in which it affects our body, and because it is new, there is no vaccination against it. Anuradha Mascarenhas, who's been reporting on the virus, joins us on a call from Pune to talk about how hopeful are scientists about a vaccination and the ways in which the virus affects our body. So, Anuradha, could you first talk about exactly how the coronavirus affects our body?
So there was a recent study from the Lancet, which has described the complete progression of coronavirus disease 19. So they studied some 191 patients, of which 137 were discharged and 54 died. But after their study in Wuhan, basically, they found that the duration of the fever was like, say, 12 days. The cough can last for a while. There's shortness of breath. So basically, there are like symptoms like fever, cough, and since the virus is, we know, spread through droplets, people can inhale through their nose, through, mouth or eye. So the basic thing is it can be either mild or it can get into a severe symptoms where people can have difficulty in breathing, especially older patients and perhaps individuals who have underlying medical conditions. Now, this is still a very novel kind of virus. However, whatever the symptoms are being presented, it's mostly cough and sore throat and fever.
I mean, obviously, this is a new virus. We don't have a vaccine for it now. But how hopeful are scientists of finding a vaccine for this? Like, how far along are they in that process?
There's a race to develop treatment. There are dozens of drugs being tested around the world. And as of now, there is no vaccine, no cure. But a lot of scientists are looking towards, repurposing drugs, or probably, even Gilead, the sciences, they are looking at these drugs which have treated Ebola. So they're looking at anti-inflammatory drugs which can lessen the symptoms. And I think in China itself, I was reading somewhere, there are like some 300 such candidates, vaccine candidates. And apparently they are planning to go into phase-wise trials from the end of April. However, having said all this, it's going to take a while, I think, because people back home in India also, they are saying that, we are looking at some drugs which have worked on similar viruses, like similar in the sense which have these kind of symptoms. And then they are trying to develop kind of drugs from there, like repurposing drugs on this to kind of see if this works. But however, again, even if it does, these creating therapies and all, this is going to take a long time. I mean, they will have to go into clinical trials. I mean, even if the Coalition for Epidemic Preparedness and Innovations is working on all this, I think it will take some time. So the best thing is simple tools like soap and water, and just wash your hands, good hygiene, and I think keep some social distances, which I think will really be effective in preventing the spread.
The virus, among various other things, has also been impacting the stock market. Yesterday, the Sensex fell around 2,919 points, which was the biggest one-day fall it has witnessed in absolute terms. But of course, it is not just the stock market. The virus has also affected the pharmaceutical sector, the poultry sector, the tourism sector, and the aviation sector. Indigo, India's largest airline, which handles nearly half of the country's domestic passengers, had said on Wednesday that it expects its quarterly earnings to be materially impacted because of the coronavirus. With travel and visa restrictions, there are also questions being raised about how it will impact the sports sector and the major sporting events that are scheduled to take place this year, including the IPL and the Tokyo 2020 Olympics. To talk about how these sporting events might be impacted, Mihir Vasavda, who reports on sports and is the co-host of our Express Sports podcast, joins us. Mihir, with the coronavirus scare and the government suspending visas and the government urging people to avoid large gatherings, how is this going to affect sporting events that are scheduled to take place in the country, especially IPL, which is scheduled for later this month?
So the Ministry of External Affairs, just a few hours back, in fact, they held a press briefing and they have pretty clearly said that their advice to the BCCI is not to conduct IPL. Again, because BCCI is a very big body and it takes decisions on its own, doesn't always really listen to the government's advice. The ball is in their court. The final decision lies with them. Even if the way things are right now, even if they go ahead with the IPL on March 29th, that's when it begins. I'll be very surprised if they'll be able to hold it with, the normal fanfare. Today, the sports ministry issued a 4-page advisory for all the states. Basically, they've sent it to all the national sports federations, to the Indian Olympic Association, and also the BCCI, along with all the chief secretaries and the state sports secretaries. And in that, they made it very clear. I mean, I'll just read it out verbatim. It says that you are advised to adhere to the advisories issued by the Ministry of Health and Family Welfare and ensure that no public gathering takes place in any sporting event. So that's pretty much it. So that basically says that each and every sporting event moving forward in the country till the advisory is revised, it will be behind closed doors without spectators.
And, with something like the IPL, and even we are talking about the India Open Badminton Championship, which is again supposed to take place later this month, without an audience, with it happening, closed doors, how does it really affect the economics of the sport?
It's a very interesting situation right now. I mean, I'll give a direct answer to your question just in a minute. But the bigger problem here that the organizers are facing, actually, more than the public gathering or the spectators part, is actually getting the players themselves. For example, when it comes to the international players in both IPL as well as the India Open, and India Open is a very important tournament because it's one of the last few remaining tournaments for the Olympic qualifying window in badminton. So the foreign players in these two events, their visas stand cancelled. And the way situation is right now, I don't think there will be any exemption. That's what the health ministry right now is indicating. So that's with regards to the foreign players. Now, the badminton players, the Indian badminton players, they have played in Spain. A few of them even, I think, traveled to Germany on their way to England right now, where they're playing the All England Championship. Now, the ministry's advice very clearly states that if you've been to a list of countries that includes Spain, Italy, etc., then upon your arrival in India, you have to be quarantined for 14 days. Now, if that's the case, then none of the Indian players like Saina Nehwal, Parupalli Kashyap, Kidambi Shrikant, all these players will be ineligible for the India Open. And Parupalli Kashyap, in fact, this afternoon, he tweeted to the health minister asking for a telephone conversation with him so that he can clarify all the doubts he has, because the players will be first going to Switzerland before they come to India. And that again would complicate a lot of things with respect to them being quarantined. With respect to the question you actually asked regarding the economics, it does not impact the non-cricketing sports as such. The gate receipts for a lot of non-cricketing events is not that high in India, but it will be a massive dent when it comes to, say, an IPL or even the ongoing India-South Africa one-day series. A lot of gate revenue, I guess it amounts to several lakhs and crores in some cases as well, which the IPL teams will have to forego. And the BCCI has indicated so far that if they will eventually explore the option of having the IPL behind closed doors, they'll try to find a way to compensate the teams for the profits lost in gate receipts.
Talking about sports, we also have the Olympics coming up this year. And we have heard from the International Olympic Committee that they are concerned about coronavirus as well. Have we heard anything from them yet, whether there's a chance that the Olympics might be postponed or cancelled altogether?
No, they have very clearly said that the Olympics will be held as scheduled on July 24th. It begins. Japan's Olympic minister today, in fact, she said that, once again repeating that there is no chance of cancellation or postponement, and they want to conduct a safe and a secure Olympics. In fact, the International Olympic Committee, they also started the torch relay. The Olympic flame was lit in ancient Olympia in Greece today. So that officially marks the countdown, so to say, for the Olympics. So in the Olympic world, they remain unaffected by the virus so far.
You were listening to Three Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcasts@indianexpress.com.